he will, there you go, Rana. I would like him to tell you more about himself and his new position with Husky for Immigrants. So Luis, go right ahead, please.
Thank you, Holly. Thank you so much. And Phil, wishing your mom speedy recovery. So thank you all so much for inviting me to be here. My name is Luis. I'm in New Haven, Connecticut, and I come from an immigrant family. And I came from Ecuador when I was 13, and settled in Connecticut. My family is of mixed status. So close family members of mine are undocumented, and sort of like that's what that has been what has guided my work. I'm currently the campaign coalition, or the campaign manager for the Husky for Undocumented Immigrants campaign, which is really exciting, and I want to share more of that in a bit with you. And then part of my work too has been around radio production. So I do radio that touches a bit on transformative justice, issues around incarceration, issues around detention, and abolition too. And in this role right now, so in my role as the campaign manager, we are expanding Medicaid to undocumented folks. This campaign started in 2019, and the aim was to open the Connecticut Medicaid state program to undocumented folks. And in 2021, we were able to open that door to children under 8 who are income eligible. And then last year, or rather this year, it's a weird warpy time. But earlier this year, during the legislative session, this year we were able to expand that coverage to children 12 and under. So as of this moment, we are continuing to build and sort of like keep the momentum going with the campaign. And in January 1st, we have the implementation phase of Husky, which where children under 12 will begin to apply for Husky. So this campaign feels like, it feels like it feels like very real, because it has like immediate impact with children. So this what we are aiming to do this legislative session is to continue to add more folks, and the aim is to have around 26 and under covered under Medicaid who are eligible. So in this sort of work, we have been building a lot of relationships with many organizations on the ground, with legislators and other folks in the community, and sort of like that's how this meeting came to be, because Holly and others and Rona have been part of the Husky Coalition, and they invited me to come and speak to you a little bit about this, and just share some information with you, and sort of say, hey, let's work together. Let's see ways in which we can work. How do we leverage our own bodies? How do we leverage this organization to support Husky? So I'll leave it there. If you have any questions around the campaign, or if you have any questions around the things that I just spoke about.
I will tell you that the majority of our legislative champions are in 3 meetings at the same time, so they are unable to join us tonight. And I have information from them, but they are not able to be here only because there's 1 in-person meeting and 2 virtual meetings that are going at the same time tonight. So they apologize profusely that they cannot be here tonight, but they are in full support of expanding Husky for everyone, no matter their status. But I didn't mean to interrupt. If anyone has any questions for Luis, that would be great. If anyone recognizes him, he was with Working Families Party, just in case you recognize him like I did. And he said it, I'm like, yes, that's right.
Well, yeah, I guess my question is, in the last couple of sessions, the Husky for Immigrants has made some incremental progress. So what are you anticipating will be the goal for this coming session in 2023?
Yeah, so thank you for that question. So we have had a couple of meetings with some folks, including Senator Looney. We met with him earlier today. We met with Matt Lesser this morning as well. We met with some other folks, and I think like what we anticipate is to go. I think like the very baseline that we're gonna see is gonna be 18. But I think like we do want to change the narrative to ask beyond 18, because because we feel that like about that healthcare is a human right, and that and that like young families, young people, that everyone deserves healthcare. But I think like like we want to continue to fight, because I think this campaign, it has been so successful because of how we have been able to engage so many folks, and that this wasn't something that was sort of like given to us, right? It was like sort of something that we fought for, and in the beginning of the campaign, like breaking that narrative that everyone deserves healthcare was sort of like the first obstacle, and how some folks in the legislature, they wanted to cover like children who are like 6 and under in the beginning, and this was like sort of like because they were saying, okay, like toddlers, they should have healthcare. So yeah, I think like we anticipate for for to at least to have like to cover like most young people, like 26 and under.
Now, you have some upcoming activities and actions that we can perhaps help with.
Yeah, no, definitely. Yes, absolutely. So starting next year, there's 3 dates that we have in mind. One of them is the first day of session. So during the first day of session, which is on January 4th, we're going to have a day of visibility. And then the following week, so the day of visibility means that we're just going to have like a few people. I think like we're going to have a few people there to say, hey, like we're here, we're not going anywhere, and that like we're here again to fight to extend or to expand Medicaid. And then on the following week, that's when we're going to have our launch. So we have at 10 a.m. at the LOB, we are going to have a press conference where many members of the coalition are going to be there. Like, we're going to show up in numbers. We're going to have like people speak. We're going to have a few legislators speak as well. And then at around 12, we're going to head out to, well, after the press conference, it might take 45 minutes, an hour. Then we're all going to walk to the Dome, where we're going to do lobbying. So that's an opportunity for folks who support the coalition to be there and show support. So I will be sharing some of this information. I will be sharing this information with Rona and with Holly to pass that to you. And then on the 17th, we're gonna do a legislative briefing. So this is a way to connect with legislators so they can present a briefing as to what the law is, what we are proposing, any relevant dates, and information that we have in regards to like some research papers that we did on opinion. Like we did an opinion poll that kind of shows that like the support for providing Medicaid for folks who are income eligible, that crosses party lines. So there's support across party lines. And then we're also going to share a research paper, some top lines from the research paper that goes into the costs of Medicaid. So how much will it cost to cover everyone who's undocumented, who's eligible, who has income eligibility, and how much would that cost? And that number oscillates around $80 to $86 million to cover everyone. And then in turn, to the state will also save, because there's a lot of uncompensated care that hospitals and larger clinics have to pay, but then they get reimbursed by the state, and that's around $63 million that the state will be saving from hospitals who are giving care to patients who go to the emergency room as a last resort when things get really bad. So those are some savings that the state will have. So those are the 3 dates we're gonna have. On the 4th, we're gonna have the visibility. On the 11th, the launch, and then on the 17th, we're gonna have the legislative briefing. And then also internally too, we're gonna, on the 1st of January, when children are eligible to apply, then we're also going to do this other organizing effort throughout the month of January, where we are going to go directly into the clinics, into some community centers to register folks. And then we have a bunch of other things that are going to be leading up to the public hearing, which is going to be at some point in March. We don't know that for certain the date yet, but it's within the window of all the public hearings have to take place. But in order to get there, we want to make sure that we are doing trainings, just like you are doing here, to do the write testimony. So yeah, so we'll be sharing that with Holly and with Rona, so that can get to you. Yeah, and then your testimony goes a long way to say that you support Husky expansion and etc. And that we can and that is not a big big lift per se, to write a couple of paragraphs in support, so that gets to the desks of the legislators in that committee. Also, sorry, I'm just gonna say one more thing. We're super excited because the chairs of the Human Services Committee, we have 2 champions. We have Jillian Gilchrist, and we have Matt Lesser, who are going to be chairing those committees. So we're super excited. They've been supporting the campaign since the get-go. So we're excited to have them chair those committees. And that just came out last week, that the chairs of those committees. Now, where so you folks who are in this meeting, you are outside of Connecticut too, or just Phil is outside of Connecticut?
Well, Phil is normally here in Connecticut, but he's just in St. Louis right now.
Right.
I think Dee is in Ohio. She joins us from SPAN, which they're an amazing organization.
Mm-hmm.
And the rest of us are here in Connecticut.
Yeah, great. Very great.
So, Luis, also, I think that, you will always have Ann's support, and as well as David Michel's support. You have their support as well. Ann is the chair of the Progressive Caucus.
Mhm.
And David isn't really in many committees that any of our bills would go to, unfortunately. But he does know who to talk to help
Yeah,
out.
sure.
Yeah. So, you know, does anyone else have any more questions or comments for Luis? Because if not, I do. I'd just like to say, I think something also we can build off of is that, okay, there may just be a $20 million difference in between the cost and the savings of the uncompensated care. But we had already talked about, you know, that's probably a lot more because of, you know, getting preventative care and
Mhm.
things like that in place. But also, you know, everyone pays taxes. So their tax money already goes into these programs anyway. So they should have a right to access them.
Yeah.
So that should also be a point of contention or a point of view, not
Yeah.
contention, I should say, because
Yeah.
we never want to be contentious.
Mhm.
Um,
No, yeah, that's a good point. That's a really good
Mhm.
point. Yeah, we talked about that, about like taxes that undocumented folks contribute to the state, both
Right.
local and state taxes.
right, without ever being able to access any of the programs.
Right.
So,
Right.
you know, right there is more of your money here. Let them access these programs. Ridiculous that they cannot.
Right.
That's something that had hit me. And of course, as anything else, if they were also to support a study bill for Husky for All, because instead of Medicare for All in Connecticut, Husky is much more recognized as the Medicaid program, and a lot of people really like the care that they get on Husky. So we want to do a Husky for All study bill, which would then, in fact, find out how much money Connecticut would indeed save if everyone were covered, period. And I believe the last time it was done, it was like 2.2 million, or was it billion a year? I always get those two figures mixed up.
Not
But
sure.
we are trying to get that through this session as well. So, you know, I just wanted to make sure that, you know, I specifically will be talking about that. So, you know, undocumented folks pay in, what is it, about 158 million? Was that the last figure that I had seen or something, Luis?
I am. It's around there. It's I think it's closer to. I think it's more than $150 million a year.
Okay, well,
Yeah.
there you have it.
Yeah.
I
Right.
know
Right. And that money is it's yeah. I mean, like that money, and also like there's money that goes into Social Security too, from folks who are on payroll too. That like
Yeah.
that doesn't go back to folks.
Exactly.
Yeah.
So that's something that I would continue to discuss. If I'm talking to a legislator, so that, you know, I know you guys have your research papers, and I think that's something that when we all get to start talking to our legislators, which is a call to action I'm going to have tonight, once we are finished, you know, that is something that that probably could help us when we do call our legislators.
Yeah.
Is that kind of a fact sheet, like a one pager, which would be fantastic.
Yeah, no, definitely. Yeah. So so thank you for that. That's a good question. So one thing that we are working on this session is to work on like a disciplined messaging guidelines. And this is so like, you know, so all of the organizations that are part of the coalition, that they are, you know, saying like, you know, there's 113,000 undocumented folks in Connecticut, which out of all of them, there's this X number that are under 26, etc. So like this is like something that we want to work on. This is and this is like so organizations like yourself, like that we are all in the like on the same page in terms of messaging. I think like the central message here, or one of the central messages here, is that everyone deserves healthcare independent from status, and that if a doctor is ordering an MRI to a patient because of of whatever, or like they're asking for imaging, and folks don't have access to those images, the state is getting in the way of people's healthcare, and then also this leads into like preventative care this leads to like not having preventative care. And it's sort of like when you have a car and like you hear a clinking noise, and you take it to the shop, and they're like, hey, like this what's happening with your car, we fixed it, now we're good. But then what happens if you don't take care of it? We're gonna continue to drive, and then like that problem is gonna get bigger and bigger and bigger, and then to the point where like that is something that costs that's something that's preventable, that can be affordable, then it becomes like this like huge thing, and the state sometimes has to end up paying for that, or not, or like folks just like like you don't have insurance, it's very difficult. My dad had a heart attack last year. He's undocumented, and it's been really difficult, because he doesn't have like regular care. He sort of like he's on the fringes of the medical care system. So I'm worried about him. I'm worried about him. I'm just really worried about him. And he ended up staying in the hospital for 3 days after his heart attack, and the bill came to over $15,000. And he's making payments on that, but he doesn't have the type of follow-up that folks who have access to insurance can have. And cardiologists are expensive, and imaging is expensive, and sometimes also doctors they have like their hands tied, because the system itself that allows them to refer to like other specialists, or to refer to imaging, the system itself doesn't allow them to do that. So what they say, they're like, okay, let's just wait on those exams, let's wait on those images, and and sometimes actors, that's all they can do, because they know that that an MRI costs thousands of dollars. They know that a cardiologist costs a lot of money. So it's it sort of like reflects on the reality of many undocumented folks in Connecticut who don't have access to healthcare. So it's really important that we as a state, we address this that we address this issue.
The more I get into this area, although I of course believe we need a national healthcare program that covers everyone, I think that it's really useful for us in Connecticut that to build on Husky as much as we can. Husky is one of the few Medicaid programs in the United States that stopped outsourcing its risk to private insurance companies back about a decade ago. And, when I've gone to national meetings, like with people from one-payer states, they're very envious of Connecticut. It came up in a past meeting that one of our Medicare for All Connecticut members is a therapist who is licensed in both Connecticut and New York, and bills Medicaid in both Connecticut and New York, And we talked about this subject in one of the meetings, and she said, oh, now I understand why my billing in Connecticut is so much smoother than my billing in New York. Because New York has private, insurer gatekeepers within the system. So I think for those of us, although there are always threats, it seems, to our advantages we have in Connecticut, it seems that we're in a more fortunate space than a lot of people in other states, and building on Husky and continuing to expand its coverage is maybe a practical pathway towards something universal here, even though that isn't the long-term goal.
Yeah, that's a really good point. Like to protect what we have as a state too, and like continue to fund it and like invest on it and get more people on it. Yeah,
and keep it public.
And keep it public. Yeah, of course.
Does anyone else have any questions for Luis? Well, I have Andrew's coming in now, so he may have some questions. I'm not sure. I think you've given us a lot of information. I know that, you'll be sharing with us more when the dates get a little bit closer, but we will definitely put everything that you guys are doing on our social media. And if you do an action network, please definitely send us a co-sponsor invitation, because we will absolutely do that as well. So January 1st, you'll be starting to go into clinics and things like that. And will you need assistance with any of that, or are you guys good?
I mean, so this Friday we have our monthly meeting at 11 a.m. So it'd be great if so there we're gonna be having a list of events and teams that we're forming. Like we're forming a lot of like really fun teams. One of which is a communications team that's gonna be working on all comms and all communications and stuff. And so we're gonna have a lot of this team. So if folks are on Friday, we have a lot of updates, and we're gonna be sort of like just like trying to draw from organizations on the ground to build capacity and and for other organizations to lend capacity. So like you, I know that you'll be there. So like I think, and anyone is welcome really to be in that meeting, where you can see a lot of like the other folks who are involved in this, and then we can just like ask you to like sign up to some of these teams, but we'll have other information, and then on also like on sponsoring the petition that we have. I think that sounds great. We're gonna be also asking folks at that coalition meeting to, if like other organizations want to co-sponsor that petition as well. So then we can spread it further, and collect more signatures, and then sort of like continue to build that momentum with that petition.
And I also think it's important for everyone who can head out to the Capitol on January 11th to be visible if possible. I'm not sure how comfortable I am yet, because I am immunocompromised. I'll think about it if it's outside. I don't know. So 10 o'clock at the Legislative Office Building. So January 11th, 10 o'clock, if anyone is interested in that, that would be fantastic. And that's something I think is really important for as many people as possible to show up and show support.
Yeah, definitely. Yeah, and we'd love to see you. We'd love to we'd love to meet you if you end up going to we'd love to meet you in person.
And not be in a little teeny tiny box.
Yeah, definitely.
Okay. And does anyone else have any questions for Luis or anything about any of the actions that are going forward with Husky for Immigrants or any of their legislation or anything?
I have an encouragement, and that is to encourage you, and this goes for anyone who's an advocate for broadening our health insurance and access to health care to everyone. And that is the issue of using the trip to the emergency room, the unnecessary trip to the emergency room. Studies have actually shown that people who have health insurance have higher rates of emergency department utilization than uninsured people do. And I encourage people to emphasize delayed diagnosis and the consequences of that, which are much worse than just a trip to the emergency department, because that's really the problem. I can, as a personal example, I've had melanoma once, and I went to see a surgeon because of an entirely different problem. And while I was there, I said, by the way, I've noticed this thing on my forearm. Why don't you just take it off just because it's changed color? And it was melanoma. And if I hadn't had insurance and the ability to go see a surgeon and so forth, I could be dead by now. I have a brother who died of melanoma. And so that's what I encourage people to do is emphasize the consequences of delayed diagnosis, and they are dire. They are absolutely dire, and they complicate everything. And I wish the best for your father. A word of encouragement there is the more you talk to cardiologists, honest cardiologists, deeply honest cardiologists, the more they'll tell you that we do far too many procedures and far too much imaging, and that if you basically have good control of diabetes, if you have diabetes, if you have good blood pressure control, and if you're on a statin, and there are cheap statins that you can get at all sorts of places, but very affordable, your survival is actually quite good without all that stuff. So I certainly hope he does find a way to get better coverage, but it's not necessarily dire that he doesn't have it right now. So good luck to your father.
Thank you.
Okay. Thank you very much for that, Phil. That's a very good point as well. That's kind of where I was going the other day when we spoke, Luis, was the consequences of delayed care or delayed diagnosis.
And I forgot to mention that when you have that clunky sound in your car, by the time you get to the shop, it's disappeared. So that isn't that always what happens. So anyway.
Yeah.
Yeah. I mean, yeah, I think like my analogy went beyond that.
Oh no, it's a great analogy. I just had to tell a little joke there. That's all.
Pete,
Yeah, it happens sometimes. You're like, the mechanic is like, what are you talking about? I don't hear, but I hear it, like they never hear it. Yeah, I get that. Well, thank you all so much for opening the space and to talk about it. I like on behalf of the coalition, like we're just so excited about this campaign and how much support we have for this, and yeah, how long we've come on this coalition to like open this door that was always shut close, and how by sharing our stories and sharing all of these issues, and organizing, like really organizing, and like we have been able to build what we have built. So it's a really exciting moment right now for the campaign.
Thank you. I wonder, Holly, if it's time for you to share some of the legislative things that our champions have in mind for this year. I don't know if they mentioned the Husky for Immigrants. They probably did, but we might as well hear
Absolutely.
about the others.
Okay, so with speaking to our legislative champions, they absolutely are behind the campaign to expand Husky to the undocumented population 100%, and are with you guys, as you know. And so we are also behind you guys. So our champions are ready to introduce the concept of expansion on the single payer study bill, and they want us to find more co-sponsors. We can go back and look at last year's bill, study bill, not, because what is Husky? Oh, Husky is what we call our state Medicaid. I'm sorry, Dave. So I apologize. So it is our name for our Medicaid. It's just another name. So anyway, they want us to make sure that we have enough co-sponsors and enough support to be able to get the study bill across. So we need to make sure that we basically do the power mapping again with our own legislators. And the most important are the chairs and the co-chairs of, human services, appropriations, that kind of thing. We will just use the language from the last time, except there will be none of this hundreds of thousands of dollars and committees attached to it if there's no need. I get confused with the doctors' names, professors' names who would do the study, but it's only like $20,000. We don't need a task force. We don't need all of that. And so we'll change that back to its original language. So we just have to make sure we do the power mapping again, and who else would be likely to co-introduce it. And we need to make sure that we have as many legislators on board as possible. And State Rep David Michel did ask that while we were doing our power mapping and speaking to our legislators, if we could please make sure that we ask the question outright: would you support or co-sponsor the Husky for All study bill? And also, would you support and do you support Husky for Immigrants expansion? And however the languages that Luis and or their coalition give us, that's the language we will use to ask the question, so that we do the power mapping as a team effort, and make sure that you report back to us. So I have my marching orders as to which other organizations that I need to contact. Yeah, so we just need to make sure that we contact our legislators, do our power mapping again. Just please contact your own legislators and let us know who they are and what they said, please. And that would be fantastic. And what we will do is we'll do a more formal kind of power mapping, and hopefully extra meetings here and there to do some actual phone banking and split things up when it gets pretty close. maybe in the next couple weeks after the holidays, and maybe right at the beginning of the session, so that we can really, really dig deep into this and get as many co-sponsors and champions as possible to get this through, so that once and for all, we'll have the answer of how much money it will save the state of Connecticut if we did have a Husky for All bill. In other words, a expanded and improved Medicare for all, which here in Connecticut would be basically Husky for All. And everything is already in place and everybody's already out of the way in our Husky. As Ron has said, it is not a privately run, it is publicly run, right, Rana? Is that how it works? Okay. And we'll keep the insurance industry out of our Husky and keep expanding it and making it better. And next month's meeting, we will have a group. It's another coalition. We don't have a name. That is trying to expand Husky for people with disabilities and for the elderly. Because as you know, current Medicare does not cover vision, hearing, or dental, which is not the whole person, and that's ridiculous. So Sheldon and I believe Molly Cole will be here to talk to us about that. But hopefully we can really find some more co-sponsors and champions besides the two that we have, because we lost a few from retirement and one due to he lost the election. So we need to find some more. And I lost track of the chat here, so, okay. And Bill, did you want to tell us about the National PNHP meeting? Oh, first, does anyone have any questions about that?
I don't have a question, but last year we put together a Google spreadsheet with all the legislators, and I'll share the screen so you can see it, but it has not been totally updated for this year because although the legislators know what caucuses and committees they're on, it hasn't really been updated on the state websites yet. So as soon as we get all that information, this spreadsheet that we had used last year also gave the opportunity for us to, anyone who contacted their legislators, to give input to the group about whether the legislators are supporters or strong supporters to the point of co-sponsors, if they're sort of, lackluster supporters that we really need to work on, if they're, not really worth our energy, or if for some of the more conservative ones, if we need a different approach, like it saves money when you take out the private insurance profits. So we will be probably by the January meeting, I'm sure we'll have that up to date and be able to share the link with people so that they can contact their own legislators and be able to share the information with the group. So we'll kind of know how many co-sponsors we can get, how many votes we can get, and which ones we still have to work on.
Yeah, and if you're in New Haven and your state rep is Robin Porter, you don't have to call her. We're all good there. But everyone else, other than David Michelle, Ann Hughes, and Robin Porter, we need to kind of, and Susan Johnson, because she's always here. Everyone else is kind of up for grabs, so. Okay, Phil, looks like you are up if you would like to let us know what you found out.
Sure. So I'll just sort of do this a little bit like bulletins. One there was a presentation of a study done in California, the title of which was "What Does Healthcare Cost? A Calculator to Compare Current versus Single Payer Costs for Households." Are you familiar with this study? Okay, so I don't need to go into it much. It is very interesting though that um, this tool revealed that for all users, they had a $9,600 savings if they were on single payer versus what they were on, and for people on Medicare, a $5,150 projected savings. And I thought that's a pretty powerful argument for single payer. The big news, which I'll get to, is there's a compact. There's many compacts. There's a dairy compact, etc. And so there is a new compact that has already, the legislation has already been passed in New Hampshire, and it's basically a plan to establish statewide single payer that will go into effect when a certain number of other states also pass the same legislation. And there's a minimum of 3 states, and everybody called it New England Compact, but actually there's nothing in the law to prohibit any other state from passing the same law and participating in this. And so it would basically pool the public resources of the states that signed up, that validated in their legislature this program. And the purpose of going about it this way is that there have been some examples, Vermont, California, come to mind, of attempts to develop statewide single payer programs, and they have not succeeded. In the case of California, there was actually a referendum, and as you can imagine, the healthcare industry spent heavily to oppose it, and it didn't pass. The title of the act, if you want to know, is the New Hampshire Interstate Compact Universal Healthcare Act. New Hampshire Interstate Compact Universal Healthcare Act. And so the purpose of presenting this was to inspire support in PNHP delegations in other states to press for this in their states. So that's a very interesting development, and bears keeping an eye on. And then well, I'm just looking to see anything very new and different. Well, yeah, so another issue that has to do with me as a PNHP member is the issue that New York, particularly New York city area, but also the northern suburbs of the city have very active PNHP participation. In Connecticut, it's kind of moribund. It's not very active at all. And so we discussed the idea of associating with the New York chapter. I've been involved in the American College Health Association for a long time, and the New York and Connecticut chapter, well, the New York and New England groups every other year have a joint annual meeting. So one year it's just New York on the one hand, and then New England chapter on the other hand, and then the other year it's both together. So we talked about that model, but I talked about my recently becoming involved here with this group, and how we could inject some uh, vigor into PNHP through building an alliance of sorts with Medicare for All Connecticut. I think there's some politics there that I'm not that are below my radar at this point, and so I can't say too much about that. Perhaps somebody here can educate me on if there are some politics. I can see from Holly's expression.
That's it. It's not that big of a deal. They don't look. Ron and myself, Sivan and Stefan. We are whatever part of PNHP Connecticut.
Mhm.
We did have a Connecticut chapter, but then nobody came anymore.
Yeah.
So it's just a semantics kind of thing where we want all forms, like we'll go for the town resolutions, we do statewide, and
Mhm.
PNHP is just all about federal. Whereas we are attacking it from every single
Yeah.
fact, period. We're just going at it every which way we can. And
Right.
for any kind of incremental change in any kind of additional health care for anyone and everyone. So
Mhm.
I believe that's the only difference in our groups. I
Mhm.
believe, I'm sure Rana knows much better than I. She remembers things better than I do. But I believe that's the only main difference, is that they support only federal, whereas we do everything else.
Yeah. Well, although you have to, the attention that was given to this compact law is, I guess, given that, is quite a departure from the all or nothing approach.
And
Because
PNHP has done terrific work,
oh yeah.
bringing attention to the whole, direct contracting entities issue.
Mhm.
But I wanted to add, though, Marilyn Vacher, who has tried to get Connecticut PNHP started for a few years.
Yeah.
She actually lives like 3 blocks away from me, and
Okay.
coincidentally,
But
but
she's in Stonington, isn't she? Or,
no, she's in New London.
oh, in New London. Okay, but I
Yeah,
mean,
she's
she's
in
in
New
that part of the
London,
state.
and
Yeah.
yes,
Yeah.
and we're
I've
we're
spoken with her on the phone twice. And so, yeah.
yeah. Weirdly, it's pandemic time. I've only spent time with her in person like 3 times, but we've been on a whole lot of calls
Mhm.
together, even though it's not an exaggeration to say we live 3 blocks away from each other. But she did call me about a week ago, and there is going to be a PNHP Connecticut meeting, I believe the third Monday in January.
Okay.
They're always Zoom meetings. And
Mhm.
I wonder if one of the topics of discussion might be some kind of collaboration with the New York PNHP.
Yeah. Well, that's one of the things that she and I spoke about. And I brought up my experience with the American College Health Association collaboration between the two chapters, and they they seem like they're doing a lot of interesting things. The other thing I forgot to mention is they started a program, and I am blanking on the name. I'm blanking on the name of the program, but basically, you know, the PNHP, like many organizations, has a certain Unitarian congregation feel. I'm 71. I'm perhaps probably the oldest person here, but and so they started a program to recruit medical students and pre-med students. And out of the approximately 400 people who attended the meeting, over 100 of them were medical students. And yeah, the enthusiasm that they injected into the meeting was just, it was invigorating. It was wonderful. So yeah, I wish I could think of the what they call that group, but that was great.
SNAP,
Huh?
SNAP, SNAP,
SNAP. Yeah.
SNAP, Students
Yeah,
for a National Health Program.
that's
Yeah,
it.
SNAP.
That's
Yep.
it. Yeah, SNAP.
Yeah.
Exactly. Yeah, no, they were absolutely a breath of fresh air.
Yeah.
Yeah. So we had this enormous bimodal age distribution of no, they were terrific. And there were some great presentations. Yeah. So that's all I can think of to relate concerning the meeting. I did meet someone from New Haven who's a PNHP member, and I unfortunately haven't had a chance to follow up on some of this stuff, especially with my personal medical stuff going on recently. But
Male,
anyway,
female,
hmm?
male or female?
Male.
Justin Paglino.
Yes, that's it. That's it.
Yep.
Yeah. Yeah.
He's very involved with us too. He's both PNHP and Medicare for All Connecticut.
Mm-hmm.
He's just not here tonight. He must have a gig or something.
Oh, okay.
Yeah.
Okay. Yeah. Yeah. All
So,
right.
I had a feeling that's who it was. That's why I said, let me.
Good guess. Good guess.
Yeah. All right. Well, does anyone else have anything that they'd like to update or any questions or anything like that? I just have one little tiny note. I know it's a little bit after, but Josh Hermson's parents were in Disney World for his birthday. So I just wanted to, just give a shout out there because I've been thinking about him a lot and I didn't know that it was his birthday yesterday. Or the day before. It was one of those days, but they're in Disney World celebrating what would have been the end of his internship for a mental health counselor. So,
Mm-hmm.
but yeah, I just wanted to give that reminder that, we still have some more resolutions to get put through and we have a lot of work to do, but I know that, it can't be done with just a few of us and we need a little bit more help, but we'll get there, we'll bring some more people in, I hope. And that's my hope, we'll just keep plugging away and we'll get things done. I'm sure we will. Everyone have a great rest of your evening. And I hope to see you all soon. But if I do not, have a wonderful holiday season. If you celebrate Hanukkah, happy Hanukkah next Monday, I believe, next Sunday night. And Merry Christmas. I do both. So I will see you all soon and always give us an email, call, whatever. We're here. So take care, guys.
Thank you.
Thank you.
Thanks, everyone.
That went pretty well.